What's up?
What's up? The duo is back. We
Back at
are.
SAM,
Hey, where are we
baby.
at right now?
SAM 25
There
in
you go.
Philly.
In Philly,
Rainy Philly.
rainy Philly. Man, the rain. Ugh. Trying to get like a lift was crazy this morning. Hey, so we are recording in
Yep.
one of the halls. Looks really nice, right?
Yes.
We're gonna
Very
do
ornate.
a very ornate. Hey, let's do a quick question. Let's jump
Yeah.
into it. We're gonna still do some teaching here, right?
Yeah. So you have a 28-year-old female. She's coming into the ED with right lower quadrant pain, pelvic
Okay.
pain too.
Okay.
And it started suddenly. She's having vomiting, severe pain. You get an ultrasound, pelvic ultrasound, and it shows a large right ovarian cyst, about 5 centimeters or something. But it
Yep.
shows normal Doppler flow.
Good.
She's in a lot
Normal
of pain.
flow.
Yeah, exactly.
Normal
That's
flow.
great. Yeah.
Got it. I like it.
Normal Doppler flow.
Yeah.
What is your next best step here?
Yeah.
She's still in pain. Choice A, discharge home,
Yep.
outpatient OB follow up. Choice B is going to be consult OB-GYN despite
Yep.
the normal Doppler.
Okay.
Choice C, give some pain control, reassess.
Yep.
Choice D, repeat the ultrasound in
Yep.
6 hours.
Ooh, okay.
Think about that one.
Yeah. Okay. Pause for this. All right. What's the correct answer here?
Now, correct answer is going to be choice B, consult OB immediately. So
Okay.
just because that ultrasound
Yep.
is negative,
Right.
quotation marks,
Right.
normal Doppler flow does not rule out an ovarian cyst
That's
with
huge.
torsion. So
That's
this is the
huge.
biggest thing here. Take it away.
I love it. You know, torsion really is a clinical diagnosis at the end of the
Yeah.
day. And my thing with torsion is it is sudden onset, severe, colicky. The times I've
Yeah.
seen, torsion, it's always like clinically, I knew it was torsion. If it wasn't a kidney stone, kidney stone is the one that
one of the
will
two.
get you, right? It's either a kidney stone or it's torsion.
Yeah.
Because it's that one-sided,
Right.
So always, anytime you have sudden onset, severe, pain, that is key. That's why the history is so important. You
Right.
can't really rely as much on imaging here, right?
Right.
Imaging, honestly, I'm not looking for Doppler flow as much as I'm looking for a cyst, right? Because
Exactly.
we know that most commonly, right, in women with cysts greater than 5 centimeters, especially, on the right side, highest risk, right?
Yeah.
So, and early on, it's very intermittent, it's very
Yeah.
painful. You have these waxing and waning symptoms, right? So, again, I think let's summarize it all up. Briggs, let's do it for our listeners.
Summarize it all up. This is a ballroom that we rented entirely for this podcast.
Yeah, right.
So thank you to SAM for giving us this whole ballroom.
Right.
A large donation from EM Board Bombs.
Right.
Hey,
right.
so the biggest things about ovarian cysts, and I tell residents and students this all the
Yeah.
time, is that you're just not going to diagnose an ED for ovarian torsion.
Yeah.
What you're going to do is strongly suspect it. You're going to consult OB.
Yeah.
And it's even easier if the ultrasound shows no blood flow.
Yeah.
But it's a rare, often missed diagnosis.
Yeah.
It's also a medical legal bomb, basically. Not a good type of board bomb.
Right.
Here. So what you're going to do is you're going to consult OB, even if the Doppler flow is there.
Yeah.
If the patient is having a lot of pain with a large cyst, go and consult them, and they're going to have to do the gold standard, which is laparoscopy.
Yeah, and a key thing too, in especially young females, like you're talking about like adolescents and things. That cyst doesn't actually have to be like that big at all either, right?
Not at all.
So again, sudden onset, colicky pain, and that's the thing. I'll always ask my residents. I'm like, "What are you looking for on that ultrasound?" And often, I'm telling you,
always
so many
the Doppler
times,
flow. It's
I
always
was like, "Oh, the Doppler flow." I'm like, "No,
exactly.
that is not what I'm
large
looking for a
cyst.
cyst, right? Because I clinically know what's going on, you know." Well, that's it. That's a nice pearl. Hey, EM Rapid Bombs, right? You want to plug that real quick?
Go to emboardbombs.com. Check us out. Sign up immediately.
Sign up. We've got
our
more than 500.
We've
got a med student podcast. We have more than 500 questions now on EM Rapid Bombs. So you can find that by going to emboardbombs.com, and then you'll look us up and check the link on the question bank and sign up.
See you soon.
See ya. Bye.